I'm Dr. Sunny Hatch. I'm faculty scholar in the John P. McGovern Academy of Oslerian Medicine. And today we're going to continue our discussion from this book, Osler, Inspirations from a Great Physician, by Dr. Charles Bryan. It's actually chapter 6 that we're going to be concentrating on in continuation from our first segment called Care Carefully. And I'm honored today to have with me Dr. Patricia Beach. Now, Trish is an emeritus scholar in the Academy, and she's a professor in the Department of Pediatrics at University of Texas Medical Branch. She's dedicated her career to the care of abused and neglected children. You know, this discussion is being captured during the COVID pandemic, but there's a deeper pandemic out there, is there?
Yes.
Could you speak to the prevalence of neglect and child abuse, abandonment?
Well, I'm not sure I can give you exact numbers off the top of my head, except to say that it's way too many. You flatter me in saying that my career has been devoted to these children. I'm a general pediatrician. The last several years, an opportunity came for me to spend more time in that field, evaluating children for abuse and neglect, and working with the foster care system in Texas to try to provide a safe harbor for children who need it. Children are abused and neglected in many ways, and sometimes that definition is pretty much in the eye of the beholder, which is one of the challenges that we have. Pediatricians are very fortunate to be in a position to help families, hopefully decompress some of their stresses, and if we're really, really fortunate, to provide some avenues to prevent some of these disasters that come to us and catch us off balance. And so my work the last 3 years has been to open some clinics to see children who have recently entered foster care, and then to follow them over the time that they are with a particular family. They move in and out of that system. And I'm working with a couple of other pediatricians to do that as well. It has been very satisfying, very validating as a part of my career to do that. And we've also been able to develop some tools that we hope families can utilize to prevent. I think many, many parents come poorly prepared to parenthood. They perhaps lack the maturity, perhaps lack the models to care successfully for their children, and things happen. And so we hope to be able to prevent some of that.
Perhaps one of the best known foster children in our history was Moses, was it not?
That is very true. And this morning I had a chance to speak to that in the sterile words of contemporary medicine. We would say a 3-month-old baby was found floating in a basket in the river by a woman of a wealthy family who wished to adopt him or foster him, and permission was given. And that's how that story would start out, an abandoned child.
You know, these children coming to your clinic, they've not had the usual relationship, if you will, with their home providers anyway. They certainly do not have a natural relationship with their parents or to some degree with society at large. How do you bring them in? How do you get them to trust you?
Yeah. So every case is unique. Probably the most prevalent case we have are infants who are delivered to women who are drug addicted and are not able to provide for the care of that child. So that's a large segment, and that is considered one form of supervisory neglect. So they are, if you're going to try to characterize children, they are neglected children. They may be born addicted. They may be born undernourished. Many times they have a family member who is eager to provide care for them. And so those children grow up in a home where they are loved and nurtured. They may bring with them some of the problems that led their mothers into difficulty. In other words, there may be some inherited conditions, but by and large, those children are comparatively unscathed as compared to older children who are removed from a setting for a variety of different reasons.
Do you believe that you can develop that trust to the point that they can then go on to be successful?
I really do. Now, I have to say that there was a study recently done in the UK, and my recollection is that they had several hundred children who were in the foster system. This was a relatively recent study. They looked at those who were in out-of-home care, who had been in out-of-home care but reunited, and those who had been involved in the system but never removed from their home. They were interested in finding out or characterizing the amount of mental health problems that the children had. They didn't really find that many of the children, both in out-of-home care, these kids had all endured one form of abuse or another. And so mental health conditions were more common, but they didn't find really a very great difference in the types of mental health issues the children had. What they found was a higher prevalence of attachment disorder among children who had endured some sort of maltreatment and were in out-of-home care. And that kind of makes sense. That's difficult to deal with. So when you're talking about trust, that is the issue. And children are amazingly resilient. So we like to, some of the caveats of care are that they need to be placed in a home-like setting, not in a group home. They need a family-like setting. They need permanency. They need stable settings. In our state and most states, the goal of temporary foster placement is to return a child to a loving home. And we have a system in place to help that happen with, of course, variable success. But many parents are able to turn things around with support from the system.
I imagine touch is different with these children because they're not used to an acceptable or what we consider to be a normal type of touching in a relationship.
Yeah, I think when you're talking about physical touch, for children can be abused physically, they can be abused sexually, and certainly those children have some fears about being around people who might harm them. Mm-hmm. So clearly there are issues that have to be settled. But I am reminded of the story of Mary Ellen Wilson. She was, I hope I have that name correct, she was the first abused child for which there was some sort of legal repercussion. She was a little girl in mid to late 1800s in New York City. Through a series of unfortunate events, she ended up as a foster child in a home and was repeatedly beaten. And initially, the concerned neighbors contacted the police and were told that there was no legal basis to try to protect her. There were no laws to protect children who were in a foster home. There was nothing to prosecute. There was no way to take them out of the home. Eventually, the foster parents were convicted of abusing her under the animal abuse laws. And she was removed from that home and placed in the neighbor's home, who first became concerned. But at her trial, at the trial of her foster mother, she said, "I've never been held in a loving manner. I've never been kissed." And that speaks to the touch that you're speaking of.
How do you instill that joy of living again in these children?
Oh, um, I think you let them be children. You give them normal activities.
Mm-hmm.
You let them be in schools. There's a whole discipline of trauma-based therapy where you anticipate that children will have some difficulties with socialization. They will have some anxiety. They will have post-traumatic stress flashbacks. And you allow them to work those things out while modeling normal, loving, caring relationships.
How about you? Because I'm sure there have to be days when you go home.
You know, I've been surprised. There are days when I go home and I have heard some horrific stories,
Mm-hmm.
seen some terrible injuries, and that is hard. But I will tell you that when a case comes to my attention for whatever reason, there are a lot of other people involved. We do what we have to do to protect the child. And then there's this little compartment in my brain where those stories go into storage. I am concerned that when I'm elderly and my boundaries break down, that I will have flashbacks to some of these stories. But really, they seem to get filed away, and a year and a half later, something may come up where we have to reopen that file, and I have to go through the whole process again because it's as if I don't really remember the details.
Mm-hmm. You know, Dr. Osler very much talks about that in equanimity, right?
Yeah.
How do you bring that balance?
I don't always. Sometimes I get a little bit angry. But I think that people who work with families in distress start to realize that there are many victims. The dysfunctional adults are often victims themselves, and it's important to feel some compassion for them. Of course, you feel compassion for the children. They've dealt with more adversity than many adults. And so I think that there's a realization that life is not good. There are things in our world that over and over and over again lead to problems in families. There, of course, is mental health. There are addictions. There is physical violence. I think one should not overlook the role of immigration into countries where families are not respected. They have a great deal of difficulty assimilating. They are disrespected. They are disproportionately jailed. And all of those issues come together. In your discussion of the Moses story, Moses' ancestors were immigrants. They lost their protections under the law. They then were forced into slave labor, and the ultimate thing that happened before this story was that there was a plan of genocide for all the little boys to be killed after they were born. Those kinds of human fears are the underpinning of these kinds of problems. And we now have many children whose mothers, instead of putting them in a river, have put them on a train and sent them north because they hope their children might have a better life somewhere up there. We need to be prepared to deal with that. Those children, many of them cannot be reunited. Nobody knows where their families are. They will need homes. They will need touch. They will need assimilation. Many of them will need healing. They will have been in a group residential setting, some for a long period of time, and that does not do good things to children.
You know, listening to you, it reminds me of the story of the Starfish. You know, the man is walking along the beach and he comes across a child, and the child is throwing something into the water, and he comes closer and he sees that the child is picking up one of the starfish and throwing it back into the water. And he asked him what he was doing, and the child told him that basically, well, the tide is going out and the sun is coming up, And if I don't return these, these starfish will die. And the man asked him, why are you doing this? There's miles of beach here. There's hundreds of starfish. And he said, because it matters to this one.
Yeah. And that is our privilege and our responsibility, is to return the starfish.
Each of us had the opportunity to create change. It will seem daunting, and the challenge will seem overwhelming. As care providers, we have a duty to embrace our role of leadership and advocacy. We must remember that to truly care is to extend ourselves to those issues impacting our patients and society at large. And as always, we must remember to care for the right reason.
UTMB Health, working together to work wonders.